We got people living in their cars, their trucks, in tents, in camps.
The street homeless population will never really go to a clinic or seek out care until it's really too late, or they'll wait until they have an emergency and go to the emergency department. There's this barrier between the homeless and the healthcare system.
Hey, John.
Even if there are resources available, the homeless often don't access those resources. The role of the UR Street Medicine Outreach Program is to bridge that gap between the homeless and the healthcare system.
It's really important for the medical community to meet the individuals where they're at. Homeless individuals don't have cell phones, might not know what time of day it is. I am the program engagement coordinator for the Monroe County Office of Mental Health RED program.
Nick Coulter works directly with Rochester's homeless people. He joined forces with Emma Lowe to help her launch UR Street Outreach. Coulter's extensive street experience was integral to Lowe's progress in bridging the gap between Rochester's homeless and the medical services they need. His primary advice? First, build relationships.
So sitting down and having a conversation about their life story, asking them what are the most pressing needs for today, and starting to establish a relationship with them.
I'm thinking, how am I going to learn from this person, not how am I going to help them? Kind of putting myself below them to try and equalize the playing ground, because they don't know who I am, they don't know what this program is, and they're probably suspicious.
You got a bike, so
plenty of exercise.
that'll definitely help.
Keeps my weight down anyways.
There you go. Yeah, you look pretty fit.
Being non-judgmental and not looking for anything to happen. People sense that I'm not there to get them to change or get them into a house right away. It puts them at ease, I hope.
It's natural in the medical field for us to look at, okay, here's a medical issue, we need to treat it, before establishing the relationship. But it really requires an understanding of the person's perspectives, what's important to them. And when you've established that relationship, you build trust. And when you establish trust, you can start to talk about these difficult issues.
Yeah, it was kind of high. It was like about like 180 over 140 or so.
It jumps up and down. Some days it's slow and some other days it's sky high.
You said that you were on medications at one time before.
Yes.
Do you know what they were?
I used to take 2 a day, 1 in the morning, 1 at night.
Lisinopril?
There you go.
Is that it? Oh, okay.
There you go. That's the
Yeah.
one. Lisinopril. That's the one. The prescription ran out and I never went to go get them again.
Yeah.
No,
Is that something you'd want to do in the future? Like get back on the meds? Because I think it would be
help
be
me.
beneficial
Yeah, I would
for your
say.
body. But it's something that, you know, it's up to you to
I
do
know,
it, because it's not
to get my
it's not gonna help for me to tell you to
I know, get off
like,
my
do anything.
get off my butt to go get it done. Yeah.
What keeps you from going, do you think?
Laziness.
It's okay. Admit it.
Yeah,
Don't worry.
I'm being honest about it.
We're trying to get people to trust doctors and trust the medical system, and getting them to enroll in a primary care clinic where they can get free services.
Ultimately, partnering with them to create goals that they want.
How would I do this now? Talk to the VA again?
Yeah, that would be
Yeah.
ideal, since they probably already know you.
'Cause I wanted to rate that medicine I was taking there. Put it. I know I was taking that stuff. I was on it for about a year or so.
Did it work for you? Did it reduce your pressure?
Yeah.
Great. Even with the person that has the littlest amount of hope to get better, you can make a difference in their lives by just doing consistent outreach and showing them that someone cares about them.
It's been nice talking with you. Thank you.
Once you learn more about any of them, you find that there's something in common. It sometimes seems futile to help them, but I was able to see that it's really not futile, and a lot of people need help, and if you give them a chance, they can get the help that improves their quality of life.
So what makes you stay out here versus back in the shelter? What made it so terrible?
What will U of R medical students learn as they get to know John? How will the UR Street Outreach Program evolve? Find out more in upcoming episodes of the Street Medicine Chronicles. For the University of Rochester Medical Center, I'm Jeffrey Mead.